Hey, future RN, you know those pain assessment questions that show up on pretty much every NCLEX? Well, you're going to see both PQRST and PQRSTU. So today, we're going to break down exactly what every single letter means, what the difference is, and how to use them perfectly so you can just ace those questions and assess pain like the total pro you're about to become.
So think about it. How do you actually measure something you can't see? Pain is the fifth vital sign, right? But here's the kicker. It's 100% subjective. I mean, what one person calls a 3 out of 10 pain, someone else might say is a 7. And that's exactly why we need a solid, structured framework to get the real story behind what our patient is feeling. It's so much more than just a number.
And hey, welcome to ClearPath NCLEX. I'm so glad you're here. My whole mission is super simple, to give you that high-yield, must-know info that's going to help you walk into your exam feeling confident and ready to pass on your very first try. We're all about breaking down those tricky topics into things you can actually remember. No fluff, just what you need to know.
And hey, if you're getting value from this, do me a huge favor and hit that like button. And definitely subscribe for more of this high-yield content. Oh, and make sure you click that little bell so you never miss the next game-changing NCLEX tip. Okay, let's get right into it. We are breaking down the PQRST and PQRSTU mnemonics. And trust me, using a structured assessment like this is absolutely crucial. It's how we figure out a diagnosis, it's how we build a treatment plan, and this is huge for the NCLEX, it's how we evaluate if our interventions like giving pain meds are actually working. So first up, we've got the classic, PQRST. This right here is your foundational tool. It's the one you are most likely going to see on the NCLEX. Each letter stands for a super important part of the pain story, giving us that full picture. Let's dig into each one. We're going to start with P for Provocation and Palliation. I like to think of this as the triggers and the soothers. And let's be super clear. Provocation is anything that causes the pain or makes it worse. Palliation is what makes it better, what relieves it. You have to know both sides of that coin. So, this is where you become a bit of a detective. You have to ask really specific questions. Things like, what were you doing right when the pain started? That gets you the provocation. Then, does changing your position or taking your meds help at all? That's your palliation. You want to know what makes it flare up. Does moving make it worse? Does stress? This info is pure gold. All right, let's move on to Q for Quality. This is where we ask our patient to describe the pain using their own words. We're really trying to understand the character of the pain. The words they choose are massive clues. They can point you toward a muscle problem, a nerve problem, or something else entirely. You know, patients can sometimes struggle to find the right words. It's totally normal. So what we can do is offer them a few options to help them out. You can ask, does it feel sharp, kind of like a knife, or is it more of a dull ache? Is it throbbing, burning? These words are the key descriptors that help us figure things out. Next up is R for Region and Radiation. Now this one sounds simple, but it is so important. First, where exactly is the pain? And second, does it move or travel anywhere else? You know, think about that classic heart attack symptom, chest pain that radiates down the arm or up to the jaw. That is R in action right there. And here is a fantastic pro tip for getting really specific. Instead of just asking, where does it hurt? Because a patient might just say, my stomach, which is a huge area. Try asking this. Can you use just 1 or 2 fingers and point to exactly where the pain is coming from? That little trick helps you zero in on the source of the problem. It's a game changer. Okay, on to S for Severity. This is where we put a number on it. We've got to have a way to quantify the pain, to measure the intensity of what our patient is feeling. This is critical for our first assessment and for checking back later to see if our treatments are working. And the most common tool you're going to use is that good old 0 to 10 numeric scale. Now, it's so important that you explain this to your patient every single time. 0 means absolutely no pain, and 10, well, 10 is the worst pain they can even imagine. This gives us that crucial baseline to work from. And finally, the last letter in our classic framework, T for Timing. This is all about the when. When did this pain start? Is it there all the time or does it come and go? And when it shows up, how long does it stick around? The timeline is another critical piece of this puzzle. So you can ask things like, is the pain worse for you in the morning or at night? But here's a really important one, especially for your NCLEX prep. Does the pain ever wake you up from sleep? A yes to that question can be a big red flag for a more severe or uncontrolled problem. The NCLEX loves questions like that. Okay, so you've mastered the classic PQRST. Ready to level up? Let's talk about the expanded version, PQRSTU. This framework adds just one more letter, but it's a crucial one that can take our assessment from just great to truly exceptional, especially when we're talking about holistic patient-centered care.
So what's this extra letter? The U stands for understanding. And this is where we ask the patient a very simple but powerful question. What do you think is causing this pain? This one question completely shifts the focus to the patient's own perspective, their beliefs, and what this pain means to them.
And this is exactly why it's so powerful. The patient's answer can hand you a massive clue. Like if a patient with new hip pain tells you, well, I just started running 5 miles a day, then bam, you're immediately thinking about a potential overuse injury. That's a totally different path than if they had no idea what caused it. So let's get down to the bottom line here. What's the key difference? PQRST is your core framework. This is huge for the NCLEX. You have got to know these 5 letters inside and out. PQRSTU adds that extra layer of patient understanding, which makes it more comprehensive and amazing for real-world practice. So for your exam, focus on PQRST, but know what that U is all about.
All right, theory is one thing, but now let's put it into practice. We're going to do a quick-fire NCLEX-style drill to test your knowledge. I'll read a question, I'll pause for about 5 seconds so you can think, and then we'll go over the answer and the why behind it. Are you ready? You've totally got this. Okay, question 1. A patient says their pain burns when I move. This statement best fits which letter of the PQRST framework? The answer is Q, for quality. Now, you might think provocation because of when I move, but the key descriptor here is burns, which is all about the quality of the pain. Okay, question 2. A patient reports sharp chest pain. Which PQRST question should the nurse ask first? You'd want to ask about region/radiation. With chest pain, you have to immediately figure out exactly where it is and if it's spreading. And question 3, a select all that apply. Which of these are components of the PQRST assessment? The correct answers are A, C, and D. Provocation, quality, and region are all part of the classic framework. Quantity isn't the right term, and understanding is from PQRSTU. How'd you do?
Let's keep going. Question 4. Which question is part of the PQRSTU assessment but not the standard PQR? The answer is, what do you think is causing the pain? That question goes directly to the U for understanding. Next up, question 5. After giving IV morphine, when should a nurse reassess pain using PQRST? The correct answer is 30 minutes. This is a critical NCLEX safety point. IV meds work fast, so you always reassess within 30 minutes. For oral meds, it's closer to 60. And our last question. An elderly patient rates their pain an 8 out of 10 but says, oh, it's not that bad. What's the best next question? Here you want to probe their understanding. A great response would be something like, can you tell me a little more about what this pain means to you? This helps you figure out why their words and their number don't quite match up. You made it through the drill. Awesome job. Okay, let's wrap this all up with the most important takeaways. I want you to get ready to screenshot this next slide because it is the perfect little cheat sheet for you to use when you're studying. It's everything you need all in one spot. So here it is, plain and simple. P is for provocation/palliation. What makes it better or worse? Q is for quality. What does it feel like? R is for region/radiation. Where is it and does it spread? S is for severity. On a scale of 0 to 10, how bad is it? T is for timing. When did it start? And that bonus U is for understanding. What do you think is causing it? Remember, use PQRST for those quick NCLEX wins and add that U for truly complete patient care. Thank you so much for watching ClearPath NCLEX. Now drop a comment below and tell me, do you use PQRST or PQRSTU more? I read every single one. You are doing an amazing job. Keep practicing. You've got this. Like this if it helped, subscribe, and I will see you next time.